Cystic Fibrosis, Birth to 12 Years by Tiffany Swanson. Cystic fibrosis is an autosomal recessive inherited disorder that is typically present at birth. It's considered to be a chronic and progressive disease of the body's mucus, saliva, and sweat glands. It affects the passageways of the respiratory and digestive systems. In cystic fibrosis, atelectasis results from blocked respiratory passages and creates a media conducive to infections. With recurrent infections, lung damage progresses and often leads to heart failure and death. Cystic fibrosis is typically diagnosed by a chest X-ray, familiar history, or can be diagnosed in utero. Sweat analysis testing or stool testing to detect pancreatic enzymes is also done. Due to the disease process being non-modifiable, nursing interventions to manage the disorder are essential. According to the CDC, roughly 30,000 people in the United States have cystic fibrosis, and there are higher incidences among Caucasian Americans. For this presentation, I'm going to discuss major body systems affected, treatments, nursing diagnoses, primary, secondary, and tertiary interventions, evaluation, as well as incorporating technology into care. Body systems affected in clinical manifestations: the respiratory system, digestive, endocrine, and the musculoskeletal systems are affected. According to Maslow's hierarchy of needs, the airway and respiratory system is of the utmost importance. The digestive system is next, followed by the endocrine and musculoskeletal functions. With the respiratory system, you have chronic cough, thick mucus, activity intolerance, inflammation, cor pulmonale, dyspnea, and hypoxia. Clinical manifestations of the respiratory system can be quite involved and affect both quality of life as well as tolerance of treatments. The digestive system is affected in terms of malnutrition, pancreatic insufficiency, and meconium ileus. Malnutrition in children is very important for children as it can cause further complication in terms of failure to thrive. A study by Sands in 2015 concluded that the nutritional status of children with cystic fibrosis was grossly affected by the disease. The endocrine system is infected in terms of increased amounts of salt and chloride lost by way of sweat, cystic fibrosis induced in diabetes, delayed puberty. According to Brown 2011, due to the electrolyte imbalance between water and salt, 3 to 4 times more salt is lost through the skin in patients with cystic fibrosis. The decrease in salt production as well as salt loss in cystic fibrosis causes mucus production that is so thick and tenacious that it inhibits the digestive process by blocking the passageways of the digestive system. The pancreatic ducts become blocked, and eventually that leads to pancreatic insufficiency. In some cases, cystic fibrosis-related diabetes can occur. The musculoskeletal system is affected and manifested as evidenced by decreased in bone mineral density, decrease in bone mineral content, difficulty absorbing vitamin D and calcium, increase in fractures, kyphosis, as well as osteopenia. In a study by Sands, 2015, Sands concluded that both puberty and growth were delayed significantly more in cystic fibrosis children than in children without cystic fibrosis. Lastly, these children have increased deficits in muscle and greater deficits in trunk and chest structures. In terms of treatments, we're doing chest PT, enzyme and fat soluble vitamin replacement, vitamins A, D, E, and K, exercise test to determine activity tolerance in children, frequent exercise, postural drainage, sometimes heart or lung transplant, bronchodilators, as well as humidified air. Treatments to treat cystic fibrosis are multifaceted and also require a multidisciplinary approach. Interventions. Early detection and treatment are paramount with cystic fibrosis. Primary interventions involve disease prevention, and because cystic fibrosis is genetic, it cannot be prevented. Secondary interventions include screening all newborns via sweat testing, genetic testing, as well as blood testing. Tertiary interventions for children with cystic fibrosis focus on disease management and maintaining optimal health for the disease state. Nursing diagnoses and tertiary interventions. Ineffective airway clearance related to thick mucus. Nursing interventions include parent and patient teaching on increase in fluids, postural drainage, chest physiotherapy, medication compliance, encouraging activity, humidified air, and keeping an activity medication log. Alter nutrition, lessen body requirements related to inability to absorb fat. Interventions include teaching regarding medication compliance, vitamin replacement, A, D, K, and E, encourage diet high in protein and calories, and keeping nutrition snacks on hand for children, as well as keeping diet logs. Participating in coughing exercises and teaching parents as well as children the prognostic value of regular exercise is equally important. Exercise will improve the lung capacity, help mobilize secretions. Lastly, children and parents can avoid respiratory triggers that cause inflammation and breathing difficulties. Evaluation. Evaluation of nursing interventions is important in order to identify effectiveness and make adjustments. So we're going to monitor diet with food logs and make suggestions to parents. Monitor activity with logs and make suggestions to parents. Monitor medication compliance with logs and make necessary adjustments. And parent and patient self-evaluations. Incorporating technology into care. With the increasing amounts and use of technology these days, the incorporation of technology into nursing planning is essential. Implementing the use of a Fitbit to track activity. Implementing the use of a cougholator to enhance coughing. Implementing use of a chest physiotherapy vest, computerized diet tracking and program, interactive age-appropriate video games to make moving fun. This is a concept map that I've developed to give you a visual aid. Thank you for your attention.